My name is Courtney Milleson. I'm a physician assistant and digestive health specialist here to share with you some interesting facts about common GI problems found in women. The American College of Gastroenterology has listed some common GI problems found in women. With some GI problems, women can even present a little bit differently than men. In general, women have an increased sensitivity that can be seen throughout the entire GI tract. And let's start with the stomach. In general, women tend to create less stomach acid than men, and throughout their lives tend to have fewer ulcers and damage related to acid. Even though women can still develop acid and still struggle with reflux, women can actually experience reflux, even though it's not doing as much damage. They can experience it more intensely because of this increased sensitivity that they have to it. Another thing that's interesting about women is that they're also less likely to develop esophageal carcinoma as well. So again, even though that there's less damage going on in regards to acid from the stomach, women tend to sometimes experience these symptoms a lot more intensely than men. Now let's go to the colon. So women generally have slower emptying of the large intestine when compared to men, but this difference tends to disappear with old age. This may be important in explaining why women tend to struggle more often with constipation than men do. And constipation can worsen over time, given sedentary lifestyle and slower metabolism. So it's important to really prioritize good health and bowel habits now. And this goes hand in hand with something called irritable bowel syndrome, or IBS. IBS occurs 2 to 6 times more often in women than men. Like mentioned before, women are very sensitive in their GI tract, and they're sensitive especially to pressures. Sometimes when there's increased gas in the colon or stool in the colon, this can be incredibly irritating to the colon wall and cause patients a lot of discomfort and bloating. The origin is believed to be due to the way the intestinal nerves send messages to the brain, the interpretation of those signals that the brain makes, and then its response back to the gut. It's been seen that even through, increased emotional stress, that the response of IBS in the gut, it actually worsens, and patients, especially women, develop worsening symptoms of abdominal bloating, discomfort. But the good news is that there's no damage being done, even though the patient is experiencing a lot of discomfort. And IBS is not to be confused with IBD, which is inflammatory bowel disease, which is separated into Crohn's disease and ulcerative colitis, which has also been seen more frequently in women as well. Symptoms of this include diarrhea, blood in the stool, weight loss, loss of appetite, and diagnosis is generally made with a colonoscopy. Speaking of colonoscopies, colorectal cancer is number 3 cancer for women. Screening starts at age 45, and and that's typically for women who are at average risk of colon cancer. Now, if you have family history of colon cancer or polyps in your family, please make a visit with us and we can discuss screening options for you. If you're experiencing any of these symptoms today, and I would encourage you just to talk with your primary care, come make a visit with us. We can kind of work with you and talk with you regarding these symptoms, especially if you're a woman, and, we understand that, sometimes women experience things differently, especially in the GI world. But the good reminder is that, we're here to help, and it's important for us to prioritize our health in this season, especially as we celebrate National Women's Health Week. This is Courtney Milleson signing off. Hope you enjoyed this video.